The chair recognizes the chairman of the full House Veteran Affairs Committee, Dr. Phil Rowe.
Thank you. And Mr. Chairman, I'm sorry, Mr. Kaufman and I didn't get the memo on the striped tie this morning. The rest of you have on. I know how strongly, you know how strongly I feel about the EHR modernization and what a priority it's been for us in the committee and for patient care. It means a great deal of scrutiny for the VA leadership, and a few years ago that scrutiny would have probably been decidedly unwelcome, and they would have been not shy about telling us so. But to Secretary Wilkie and his team's credit, they've been engaging with the subcommittee constructively. And I told the Secretary, I said, if we don't get this right, you and I need to go on the witness protection program, and I hope they hold a couple of spots for us. I've been watching this, the EHR modernization plan to come together the last year and a half, and during Secretary Shulkin's tenure, there was an intensive look at interoperability. And I expressed my concern about transferring all patient data, and that became obvious when I was at Spokane a while ago. It seems to have worked, VA seems to have worked through those issues and understands what capabilities Cerner provides out of the box and what additional work will have to take place. But this by no means is interoperability with the community providers, and we know that's not easy. Again and again, we turn to a basic question like how the VA system will be situated with respect to MHS Genesis and how the clinical standardization is going to proceed. I'm a little uncomfortable about that. Ideally, those questions would have been answered first. That being said, as long as they are thoroughly and transparently answered before Cerner starts installing the EHR in Seattle and Spokane, the situation should be manageable. Now, Dr. Cooper, typically, after EHR implementation, the medical practice suffers a large productivity hit. I know when we put hours in our office, the way we solved that problem was the doctors just stayed late at night.
Forward here. We are looking at all the different possibilities in terms of what the percentage will be. We're making active plans to mitigate the loss in productivity that will occur during training and go live. We have a committee that is headed up by VHA that is looking at various strategies. Some of the things we're looking at are using our telehealth capacity to see patients. So while the folks that are at the IOC sites are getting trained and getting used to the system, we're looking at bringing in temporary staff to help see patients while the staff at the sites are also involved. We're looking at how we can use the community resources if there's a decrease in capacity, a variety of mitigation strategies. And we also have a very, very robust change management and training strategy so that staff will be able to quickly get accustomed to the record and be able to regain their productivity quickly.
I've been warning VA groups when I go to see them that this is going to happen. We already have a shortage of staff at the VA, medical staff. This is going to be a big hit for the Spokane region. We know what happened in DOD. We've already at Medford. We know what's happened there already. So I think that's something we have to plan for. And I hope you are doing that. And I just wonder how you're going to be able to do that, whether you're going to, and the other thing I want to know is that from DOD to VA to Mr. Lamb's questions, what have we learned from there that's transferable? And maybe, Mr. Dalton, you can answer this to VA, because, and the other part of the question is, I know the people, I know when we put it in our own office, but implemented it, the people implementing it knew very well. But are you getting the information out to the worker bees, the people actually going to be using it at the site? People implementing it will know very well. They'll have had weeks and months and maybe a year or so of training on it. But the person actually doing the care and the nurses and the doctors, are they going to be brought up to speed in time to do this? Because this is a big process you're going through.
Thanks, sir. Appreciate the question. Yeah, we learned some hard lessons with DOD. There's no doubt about that. I think transformation is always hard and it's always difficult. We're doing a lot of things differently here. So we're engaging with the sites early and often. So one of the things that we've done is a current state review and assessment. That's an activity here we didn't do with the DOD. We're also doing 8 workshops. So we're doing more workshops up front. We're doing more of an iterative process where we're getting regular design review and we're making sure that it's understood what those decisions are that are being made. This is a provider-led process. We have 18 councils with a variety of input. They're also assisting us to the earlier question, with validation of workflow done to date by the DoD, new workflows that we need for VA, and then they're assisting with validation of those elements. And then several other things too, sir, around training. We've created 100 to 400 level courses for the VA based on workflow, not based on just the function that you serve, but based on the workflow, the entirety of the workflow. We've got a VA play domain that we're introducing that will allow folks to get in early and have access and a better understanding. And then Cerner will be providing the help desk support direct and also ongoing sustainment in the VISNs and at the VAMC. So
Let me give you one.
Yes, sir.
I know my time's expired, but I want
Yes,
to
sir.
say one other thing before I finish is that what you have to make this implement and work correctly is that when a provider is sitting there at a computer screen, and I've been there, and you hit the blind canyon, you don't know where to go, you're stuck. You can't call 1-800-HOLD. You've got to have somebody immediately available to be able to access you to get you through that. And I would encourage you, if you don't do anything, that will stop a lot of the decreased productivity, is just having somebody get stuck and they don't know where to end up. I yield back.
yes, sir.